If we look at the status of hunger around the world, Africa and Asia account for 90% of all cases. And Africa is disproportionately affected. We are roughly about 12% of the world population, but about 30 to 40% of all people going to bed hungry. And this has major implications, particularly for child survival and development. One of the worst indicator of malnutrition and hunger is the level of stunting among children, where in our region in Eastern and Southern Africa, we have rates that reach up to 53% of all children being stunted in countries like Burundi, Madagascar, Ethiopia. And this has major implication for the physical and cognitive development of children that translates itself in their health status and in their ability to learn. And of course, they being the future citizens of the countries, that has major implications for development. To ensure optimum nutrition, we do need not only food security, but also nutrition security. That has implication in terms of quality of food, but also access to water, access to sanitation, and also hygiene. And that all together combined will improve the quality of life of children and then the quality of the nutrition that they get.
I intend to work on the issues of malnutrition in children and mothers. And we want to work not only with the ladies, but also with the Ministry of Health, other parastatals, private sector, and international organizations to draw their attention to the fact that a healthy mother gives birth to a healthy baby, and a healthy baby grows to a healthy, strong, and intelligent young person. And this is the real people who will be able to carry our country forward in terms of development and education.
Although Eastern and Southern Africa region is not on track to reach MDG 1, there has been some remarkable successes on nutrition policy, advocacy, and scale up on some core nutrition interventions. UNICEF has been actively engaged with the African Union and key partners like WFP, WHO, FAO, civil societies, RECs like Eastern Central Southern Africa Health Community to raise awareness on the significant impact of nutrition on child survival, development, and national economic growth and development. So a number of countries are now raising nutrition profile higher in their national development agenda. For instance, Kenya is among 5 countries in the region that has achieved universal salt iodization. A number of countries have reached high coverage of vitamin A supplementation through child health days like Rwanda, Somalia, and Ethiopia is scaling up community-based nutrition program to promote and support improved maternal nutrition, optimal infant and young child nutrition, and both Malawi and Ethiopia are scaling up management of severe acute malnutrition.
Malawi managed to achieve the successes because of the highest political will, where the president himself is the minister responsible for nutrition. There is also a secretariat, the Department of Nutrition, HIV and AIDS, which manages and coordinates the programs and provides policy direction. And from there, nutrition is a common service because it's cross-cutting. Or if every stakeholder has to play his role. In order for Malawi to synergize with other sectors, such as agriculture, education, health, among others, there were stakeholders consultations. From the consultations, we developed the policies, but in addition, we have a business plan. The business plan spells out the role of every stakeholder based on their comparative advantage. Further to that, we have mobilized the resources that are assisting every stakeholder to implement the programs. But government has also put aside a budget for nutrition.
Community management of acute malnutrition essentially is a community-based methodology to treat children who have malnourishment. So it used to be that any child that was malnourished would have to go to a health clinic or a hospital. With the introduction of community management of acute malnutrition, these children are being able to be treated at home in the community. And it simply means that children are identified. If they have no underlying medical problems or infections or illnesses, then they're sent home with a ready-to-eat therapeutic food that their mother gives them based on how much they weigh. And they return to the health center once a week to be weighed and monitored and to get a supply, then replenish their supply of the therapeutic foods that they're given. In Malawi, this was first tested in 2002 in 2 districts, and it was found to be very successful. And so in 2004, the government, through the Ministry of Health, decided to scale this up. It's now in almost all of the health centers. A lot of the success is based on that, you have well-trained clinical officers and nurses and health surveillance assistants at the health center, and they help in following up children in the community itself.
The role of private sector in the treatment of acute and severe malnutrition is quite enormous. You may understand the private sector is able to bring the ready-to-use therapeutic food within the context of where it is required. And our coming in as a private sector has assisted to make the product available to the community that needs it most.
Tapozira zakuti mwana kufuna kumphikira zakudya monga zakhala kulenga mchere ndiufa kumphikira mwana uja kumpatsa kuti mwana uja akhale ndi thanzi.
Hayi nda mwana.
Together with the community management of acute malnutrition, UNICEF's been helping the government to implement a social cash transfer scheme, which really targets the most vulnerable households in the community. And it's targeting families that are ultra poor and labor constrained. Early research on the program showed that in terms of nutritional status, families that were receiving the cash transfers had much better nutritional outcomes. Because of it, they were able to afford a varied diet, had a stable supply of food.
Zakudya zimene timakhala kugula pano pakhomo ndi chimanga ni ndiwo za somba, tomato, komanso mchere ndi misopo.
And child health days have been running in Malawi. They're run twice a year, and they're in conjunction with the routine health services. So children receive a package of preventative health services. Namely, they do get vitamin A, as well as deworming and some checkups. And we make sure that vitamin A is given because vitamin A prevents blindness in children, and it also helps to boost their immune system. So if they get something like a diarrheal disease, respiratory infection, or measles, we know this will greatly reduce their chance of dying from those diseases.
Ine ndilosangala kwambiri potenga nawo mbali ya umoyo wa ana wa sabata ino tifoti ndi zinthu zothandiza kwambiri zimatha kuthandiza ana athu amakhala umoyo wathazi chifukwa amakhala kuti akuonedwa nthawi yonse. Ndemo ngati imenenso kwabwera iyi kampeni ya vitamini ndi abendazoni ndi zinthu zothandiza kwambiri chifukwa mwana wathu akampatsa vitamini ndiye ndoti akhala wazelu komanso ndoti adziona bwino komanso kumbali ya bendazoni njoka za mimba mwana nde utatani tanteteza ndewo lonso mklasi mwana makhala wazelu chifukwa kuti nanga si tinamuteteza kale poyambirira kufika na kukula ndi amakhala kuti mutu mwake ubongo wake umakhala kuti unongana bwino ndiponso luli wazelu.
Kenya is one of the few countries in Africa which has achieved universal salt iodization. That means 90% of households having access to iodized salt. This was a success story not for just Kenya but for the rest of the East African community. We did that with three methods. One, partnership with the private sector, the regulatory authorities, and then our international collaborators, especially UNICEF. Now we started off with involving the industry and training them to make sure that they iodize salt. We did that with UNICEF. Then we trained the regulators, that is Kenya Bureau of Standards, so that they could measure the iodine content of salt. As a ministry, we spearheaded the program, and that is the reason why we have achieved 90% iodization of salt in Kenya.
Salt iodization globally has been shown to be one of the most effective interventions in terms of promoting good brain development for children. And in Kenya, in the past, we had a specific issue with lack of iodine resulting in poor brain development and a number of other health problems related to that. So initially UNICEF worked with the salt industry to promote this iodization, and then the salt industry took it upon themselves to import iodine and take on a high standard of salt iodization, which now almost 98% of Kenyans are actually consuming. And it's of additional benefit that this same salt, because it has achieved this high standard, is now being exported to a number of countries in the region. So there is great credit due to the salt industry in Kenya, who has taken this on, and it's become a huge public health intervention and has contributed to better development of children's brains in Kenya.
Yes, that's fine. Just continue.
Through the production of iodized refined salt, we feel that there is a lot of benefit that we are passing on to the community, especially the children. And it is our corporate social responsibility to make sure that we do so. We have to roll out a product that will carry this all-important iodine to children, to adults, to everybody across the board, to the populace. The partnership between the government, UNICEF and KenSalt is geared specifically to ensure that this all-important iodine gets to the children. That is the most focal point of everything. Now, we have to work together in the sense that the government has to set the standard How much has to be given? How much has to be put in the salt? UNICEF has to do more research, to continue to guide, to continue to get international norms, to ensure that the product is perfect. And then we have to produce that product according to the specification and distribute it. That's where I believe the partnership comes into play.
At NACMAT, we are happy to be associated with the government and other bodies, including our manufacturers and also UNICEF. We want to help promote the benefits of iodized salt. We know the benefits of the iodized salt, and this is what we'd like to pass on to the consumers.
I decided to use iodized salt when I was pregnant because I received education from the ministry and from UNICEF projects about the iodized salt. It prevents brain damage, and that's why I'm using it for my baby so that she can grow and be intelligent and healthy.
Thanks to the efforts made by Ethiopian government to reduce child mortality, the results that we have achieved through this intervention is reduction in child mortality through high coverage of supplementation and child screening and the OTP services. And this is as a result of active community involvement, and also partners' involvement is also crucial.
There has been fantastic progress in Ethiopia in terms of addressing malnutrition. First, through the establishment of a national nutrition policy, which has really provided the framework for responses. And the most important parts of the response have been treating severe acute malnutrition at the community level. Led by the government's health extension program, Ethiopia has been able to expand the reach of treatment of severe acute malnutrition at community level. In 2008, we had less than 500 sites treating children. We now have 7,700 sites, reaching on average 200,000 severely acutely malnourished children each year. We have very low mortality, very high recovery rate as a result. In addition, we have a very exciting program called Community-Based Nutrition that focuses on preventative nutrition. It's a program that reaches 1.6 million children in about a third of the districts of Ethiopia. Eventually, it will be rolled out to the country as a whole. That program focuses on community engagement and a dialogue about nutrition. It focuses on growth monitoring to make sure that the children are weighed. Those children that are progressing properly go home with the increased knowledge from the community discussion. Those children that have problems are referred to either programs that deal with severe acute malnutrition or programs that deal with moderate acute malnutrition. Because it's a preventative program, we catch the issues early, and as a result, there is a profound impact on the nutrition of the child. What makes this program successful is, first of all, we are all working under one policy, the National Nutrition Policy. And when I say all of the partners, the World Bank, World Food Program, Japanese government, several of the NGOs, as well as UNICEF, collaborating together in support of the government.
The community-based nutrition program involves community through growth monitoring and promotion session conducted by voluntary community health worker to support mother to understand the nutritional situation of her child. After this all information will go to the community, and the community will discuss on issues why malnutrition is happening in their community.
Amara kom ejo yakara ragesi Gese na fa jeji daga aka kuna rase ne fi zinji ba tinjira.
For countries to reduce significantly chronic malnutrition, they need to scale up essential nutrition interventions during the narrow window of opportunity, which is from conception up to 2 years of age. And for countries to do this effectively, they need to put into place 7 key success factors.
The final result that we wanted is to expand this important program to all over the country so that every children will be benefited and the days related to malnutrition will be decreased.
In order for other countries to achieve the goal of universal iodization of salt, they must involve 4 principal actors. That is ministries of health, right? The regulatory authorities who regulate trade and standards, right? The manufacturers and other international organizations such as UNICEF, which who do the advocacy, because UNICEF is excellent at advocacy in terms of getting members of parliament, the ministers of health, trade and standards to be involved in that. That is crucial. If they are not involved in the initial stages of an iodization program, nothing will move.
My main message to prominent women of Africa, first ladies of Africa, and ordinary women in Africa is to remember that the first 1,000 days in a child's life is very, very important. This is the period from conception to 2 years after development. A child must get proper food in order to avoid malnutrition and therefore avoid wasting and avoid stuntedness at the end of the day.
In order to